Welcome everyone to today's event where we are, excuse me, very happy to discuss Lab Director Wendy Kedge's new book, Spiritual Care, the Everyday Work of Chaplains. Hot off the press. Is it literally today, Wendy? I know the dates are literally today. My name is Michael Skaggs. I'm Director of Programs at the Chaplaincy Innovation Lab. Let me say a few words on behalf of the lab and then we'll get started. First, like almost every event we have, this is being recorded. And so if you miss a point, you want to come back to it, don't worry. You can always watch it later. You'll get a link to that recording. When you get that email that has the recording, there's a link to a very brief survey about our time here today. Please just take 30 seconds to fill it out. It helps us plan our future events. So let me introduce our guests very briefly, then we'll hand it over. We're joined by Wendy Kedge, founder and director of the lab, Barbara Mandel, professor of humanistic social sciences at Brandeis, but most importantly today, she's the author of the book we're going to be discussing. We're also joined by Barbara Savage, Geraldine Siegel Professor Emerita of American Social Thought and Professor Emerita of Africana Studies at University of Pennsylvania. John Schmaltzbauer, the Blanche Gorman Strong Chair in Protestant Studies at Missouri State University, and Rabbi McCall Springer, manager of CPE at New York Presbyterian Hospital and advisor to the lab. Thank you all for joining us. Wendy, we're going to turn to you first to hear about the origins of the book and why you wrote it. And then we're going to hear from the panelists on why this is a significant contribution to the field.
Super. Thank you so much, Michael. And thanks to all of you for taking an hour out of your day to be with us today. It's a big day, long time coming. I appreciate your patience as I'm trying to recover from a cold. The book just started to ship at the end of next week, so I think it's safe to assume that no one has yet read it. So I thought what I would do is offer a few words of overview here, lay out what the main questions are and why I think they're important questions to ask, and then highlight some of the key arguments. And then I'm really eager to hear from my colleagues here about their feedback. This book is essentially the intellectual rationale for the lab, and so I'm especially pleased to get a chance to share it with all of you first. Here it is, if you haven't had a chance to see it. The cover is a chapel that's inside of Government Center in the middle of Boston that nobody knows is there. So I thought I would start with two stories and then lay out my questions. Both are historical. The first one begins in January of 1955, when the Boston Globe published the headline, "Chaplain Braves Guns of Convicts to Aid Hostages." Frustrated with long sentences delivered by criminal courts in Massachusetts and the lack of hope that went along with them, 4 armed prisoners had taken 11 people hostage at the Charlestown State Prison. Catholic prison chaplain Edward Hartington was there. 3 years earlier, in 1952, Father Hartigan had spent a night with barricaded prisoners in another standoff, helping to bring about the release of 2 guards. "We knew we had a chance as long as Father Hartigan was working on our behalf," one of the guards said after the conflict. "If anyone could save us, we knew he could." Father Hartigan was born in Lowell, Massachusetts. He went to St. Francis Xavier University in Nova Scotia and St. John's Seminary in Boston and was ordained in 1942. He served 2 local parishes before becoming a chaplain at the prison in 1951 and also directing the Guild of Our Lady of Ransom, a group founded by Boston-born Archbishop Richard Cushing to support rehabilitation for current and former prisoners. During the 3.5-day standoff, as reported in the Globe, Father Hartigan accompanied state officials into and out of Charlestown State Prison. He cared for hostages and the ringleaders, and along with the prison physician Samuel Merlin and Protestant chaplain Howard Kellett, he was granted free access into the Cherry Hill cell block where the hostages were being held. With Dr. Merlin, he listened to the prisoners' concerns about long sentences. He told the Globe he remained optimistic about a peaceful settlement, even as state police brought in an army tank and prepared machine guns, riot gear, shotguns, tear gas, and bazookas. After 85 hours, the prisoners surrendered to a 7-man citizens committee, convened by Father Hartigan at the direction of the ringleaders. This 7-man committee included the president of the Boston Bar Association, the editor of the Christian Science Monitor, and Boston's Catholic newspaper, The Pilot, the prison physician, the Protestant chaplain, and a member of the Governor's Council. As the prisoners turned over their weapons and released the hostages, the Citizens Committee agreed to work as a group to improve prison conditions. Tired the evening of the release, Father Hartigan told a Globe reporter, "The prisoners still trusted me, and that means everything to me." He also told the reporter that he preferred to stay in the background, calling the support he offered for the welfare of prisoners and their hopes and fears his life's work. 58 years later, chaplains were much more quietly on hand at another moment of crisis in the city of Boston, the Boston Marathon bombing. As first responders rushed to Boylston Street moments after the bombs exploded on that sunny Monday in April, chaplains and spiritual care providers began their work in the city's hospitals, fire and police departments, and civic response teams. A National Guard chaplain was present in the bunker with the city and state crisis leadership and activated other chaplain teams across the state. A community chaplain called trauma specialist from the Boston Public Health Commission, and she remembered telling them, "We have a group of chaplains that are prepared to support in any way needed." After submitting their training certifications to the commission, this chaplain served in a dispatching capacity, and she told me in an interview, "We need 2 people in Dorchester at the park. People are gathering to mourn Martin Richard. We need people down at the castle to be there for the runners who are coming to collect their things. Okay, dispatch chaplains over there." News reports describe chaplains who were active in the city's hospitals in the days that followed. The Huffington Post described patients and staff members at Boston Medical Center talking and praying with chaplains who also provided for things as seemingly mundane as finding outlets to charge phones. Bombing victims and the suspected perpetrators were rushed to many of the area hospitals, but particularly to Beth Israel Deaconess Medical Center, where staff, including chaplains, cared for them. Gratitude and determination were central to what the Reverend Julia Dunbar, who was then the director of pastoral care at Beth Israel Deaconess Medical Center, reflected, saying, "There's a whole level of heartbroken, life-changing work. Where do we go from here?" kinds of questions. She told a reporter that hospital staff, from environmental services workers to trauma surgeons, were all impacted. Quote, "Some started talking about previous trauma that they hadn't identified as trauma. Some talked about just incredibly strong faith. That was their complete focus. Another person talked about cleaning, mopping and cleaning, mopping and cleaning. Bottom line," he said, "it's got to be clean for the next patient. We've got to take care of the next patient." In the days and months that followed Boston Marathon bombing, chaplains joined local clergy and trauma experts across the state as they publicly and privately supported first responders, victims, family members, and many private citizens. Robert Randolph, then chaplain at the Massachusetts Institute of Technology, led prayers at the memorial service for slain MIT police officer Sean Collier. The Red Cross deployed chaplains, which they called disaster spiritual care providers, in Boston. And there were interfaith services and comfort dog ministries, crying and singing and talking and listening. Chaplains at Spalding Rehabilitation Center were available to victims through their months and years of recovery. And caregivers supported many across the state with the anxiety, transition, and public and private questioning that followed the bombing. To the extent that he is treated like other federal prisoners, the convicted perpetrator likely has access to a chaplain in the federal prison where he now resides. Father Hardington and the chaplains involved with the Boston Marathon bombing are just a few of thousands of chaplains that work across Boston, across the country, and around the world every day, usually in the shadows. In March of 2020, the Chaplaincy Innovation Lab partnered with Gallup, and we completed a survey that suggests that about a quarter of Americans have had contact with a chaplain at some point in their lives. The public became more aware with chaplains during the pandemic. They were on the front pages of newspapers. They were often profiled as being in hospitals, communicating with people who were ill by baby monitors, doing lots of FaceTime interaction, trying to connect people who were ill with their loved ones. This book steps back from all the spotlight, all the stories in the paper, what was happening during COVID, to ask a set of really straightforward questions. Who are chaplains? Where do they work across the United States? How is that work connected to the settings where it takes place? And how have they both responded to and helped to shape the American religious landscape? This book is the first to focus on a single geography rather than on a particular sector. So all of the previous writing about chaplaincy in the United States focuses either on military chaplains or healthcare chaplains or chaplains in higher education. No one has tried to synthesize across the different settings where chaplains work and think about how they are or are not a part of broader religious ecologies, groups, institutions, etc. And that's what I'm trying to do in this book. So what are the motivations for the book? On the scholarly side, there's a couple of important motivations. First, People have thought a lot about how congregations and denominations and other religious groups relate together. We could think about them as kinds of religious ecologies, but they've almost never thought about chaplains as part of those ecologies. Yet chaplains work down the street and around the corner from many of those congregations. And I think if we're going to fully understand both the history and the current practice of religion in the United States, we need to think about the role and the place of chaplains in those stories. Second, as we all know, American religious demographics are changing a lot. A third of people under the age of 30 are not religiously affiliated, and more congregations are closing. A colleague and I have been building a database of all of the congregations that have closed in Boston since the year 2000 to see what happened both to the people and to the buildings. Short story there is a lot of them became condos. But what does that mean? How does that shape kind of American civic life and where people go when they're in search of support and need, if not to local congregations? I sometimes say that my grandmother had a trouble or a problem, she would likely talk to her local Methodist or Presbyterian minister. My parents, much the same, but me and my children, that's a question. And that's part of what we're wondering about here. Do chaplains play a role in those transitions? And the third motivation here is to really think hard about religious leadership and all of the forms religious leadership has taken, does take, and what we can learn about religious leadership from thinking about chaplains as a case. So those are three of the scholarly motivations: thinking about religious ecologies, thinking about changing religious demographics and the role of chaplains in them, and thinking about the development and practice of religious leadership. The applied or practical motivations are perhaps more important, which is to ask simple questions about whether chaplains who are doing the work today are being prepared for what they're being asked to do. Is the training working? Are they in the places where they can do the best work? Particularly as congregations close and more people are religiously unaffiliated, are chaplains trained and prepared to be with those individuals? And do the business models exist to make it possible for them to do their best work in those in-between spaces? So those are some of the motivations that brought me to the project. And the story I tell has several key punchlines. So to summarize again, just briefly, what I can see from looking both at the history and at the current practice of chaplaincy in the United States, and in particular in Boston, are a few things. First, chaplains have shifted from being mostly Protestant men to people from a range of gender, sexuality, religious, and racial backgrounds in the last 50 years. It's been slow, and we can talk more about that, but there has been a significant demographic shift in who chaplains are. People come to the work of chaplaincy and spiritual care along multiple paths. Those who stay tend to see themselves making a difference, appreciate the flexibility that the work allows, and in some cases are strategically using the category of chaplain to enable them to do the work of religious entrepreneurism, which I can say more about if that's helpful. A third key finding is that the work varies a lot by setting. So the thing that most influences how chaplains do their work is the setting or the place where they work. If it's in the military, if it's in healthcare, if it's in a local fire department. And I develop in the book a continuum where I lay out the different factors that influence that work. But organizational setting, in my view, and I'm a sociologist, so I'm probably biased in this direction, plays more of an influence on how chaplains do the work than does any particular factor about the chaplain themselves. Most all chaplains work with and across religious differences. It's part of the kind of job description, basically. And the work of chaplains continues to be made possible by both historic and continuing relationships between religious groups and the settings where chaplains work. And that finding has really important implications for how we think about the future of chaplaincy. Chaplains are not divorced or separate from local religious ecologies. They're very much a part of them and have long been. And part of the history I tell in Boston kind of brings home that point. So how do I develop these arguments? Again, in brief, there is no common definition of what a chaplain is in American religious life or culture. And for the purposes of this project, I decided that people who identified as chaplains were chaplains, and I was looking to interview them. This was a kind of mapping project. And so I put out the call and tried to interview as many people in the greater Boston area who identified as chaplains as possible, particularly looking to interview people from as many different institutions as possible. So I didn't interview many chaplains from the same institution. I tried to look across. And I found chaplains everywhere from the places that we know, the military, state and federal prisons, healthcare organizations, to places that are often not thought of, social service organizations providing services to the unhoused. The Mass Corps Fire Department chaplains has a very long history in Massachusetts. So if you scratch the surface a bit, I found chaplains in many both known and unknown places, the airport and ports. I also, with some students, developed a database of every article in the Boston Globe that mentioned the word chaplain between 1945 and the present. So this was an attempt to begin to have some post-World War II historical trajectory, so I could situate the contemporary interviews I was doing in the best history that I could do as a non-historian. I also visited many archives and said, I'm a sociologist, I don't know what I'm doing, please help me. And looked at many archival documents, again, to try to piece together this history. There are holes, and I hope a historian will do it better. But there are also a lot of interesting stories there that people have not told. And then, as I said at the beginning, I interviewed 65 chaplains. I shadowed as many of them as they would allow. And what I'm ultimately doing here is telling a story about Boston. And I want to encourage all of us to generalize from it with care. So the book proceeds through 6 chapters with a conclusion. I do the best I can to trace the history of chaplaincy in Greater Boston. The Boston Fire Department had its first chaplain in 1906. Boston's Logan Airport had one of the first airport chapels and chaplains. South Station, the big railroad terminal in Boston, for anybody who comes through, used to have both a chapel and a chaplain. So I found a lot of interesting, often overlooked stories. And I found that this is where the shift happened from mostly Protestant to more religiously mixed chaplains, some full-time, some part-time. I then ask in the next chapter who chaplains are. And of the 65 that I interviewed, about 90% have some theological education. I suspect that that is high compared to other cities, given that the average education in Greater Boston is higher than many other cities. Just under half of the people I interviewed are full-time employees. They've come along a breadth of paths, locations, and have many different connections to local organizations. I refer to them sometimes lovingly as a motley crew. People come from a broad range of settings. And despite a lot of discussion and debate amongst chaplains themselves about board certification and professional credentialing, very few of the 65 that I interviewed were board certified, which encourages us to think about that perhaps in a broader way. In the next chapter, I think about the work that chaplains do, and I build this continuum from those who are most integrated and do the broadest range of different things in the organizations where they work, and they tend to be healthcare chaplains, to those that tend to be less integrated. And ironically, it's prison chaplains who, despite being the sort of most physically integrated, they can't leave the units where they work or the prisons where they work, are those that do some of the care that requires the least integration. So leading religious services, counseling prisoners. Many prison chaplains do death notifications. I then talk about what the work is. And the most common phrase that I heard is about holding the space. And I delineate the many ways that chaplains help people create and hold space and what they see their job to be in those moments, which is often not to fill the space, simply to create it and help people as they wish to move through it. I have a chaplain about the way that a chapter about how chaplains work around death and end of life issues, because if there are 2 things that all chaplains do, one is work around death. The other is to help people have peripheral vision, which is a phrase that a chaplain used to describe helping people pick up their heads in the midst of difficult situations and place themselves and their stories in broader contexts that can help them come through and move through those situations with as much ease as possible. And then I have a chapter about religious diversity where I look specifically at how 3 different Boston institutions, the Boston Fire Department, what is today the New England Seafarers Mission, which is where port chaplains work, and Massachusetts General Hospital, have responded in different ways to the shifting religious demographics of Greater Boston. For people that have limited time and are most interested in the applied messages, just read the conclusion, because in the conclusion, I do the best I can to summarize what I have found empirically, but also then to think about the future. And there are 2 equally compelling stories about the future that are starkly opposed. So there are reasons to think that chaplaincy will grow, and there are reasons to think it will decline. What are some of those reasons? Well, we know that congregations are closing. That could lead to there to be more demand for chaplains, but we know that quite a few chaplains are actually supported by their congregations. So there could also be fewer resources for them to do their work. We know that theological schools are developing chaplaincy programs, but I would argue that they're often doing so too slowly, and the programs are still too expensive for many of the second career people who come to chaplaincy with important life and professional experience that came before. We also know that enrollment in theological schools is going down. So what direction does that lead the future? That's an open question. We have data that show that about 14% of local clergy also work as chaplains. which comes back to that means that congregations are paying their salaries. So if those resources decline, what happens to chaplains? And perhaps most importantly, the United States is secularizing. And while the term chaplain opens doors for some people, it sounds familiar and accessible. For many others, it sounds like too old-fashioned of a term, not something that they identify with or that means anything in particular. So you could argue that chaplains have a PR problem, that their work is very important, but the ways of making it accessible to younger people, perhaps, who've never been religiously affiliated, is an open question. And with McCall and some colleagues, we actually just completed a mapping of Jewish chaplaincy. The working paper is up on the website. And as part of that, we interviewed Jewish professionals about what their needs were. And one of the things we found is that often in Jewish camping groups and others, there is a need for someone who does the work that chaplains do, but those professionals don't often think of chaplains as the people doing the work. So we need to think perhaps in creative ways about the box. I have more specific call outs in the conclusion for different groups, theological educators, chaplains, and others. But let me stop there. I'll say that I introduce each chapter with stories of different chaplains. So I tried to do the same in my talk here today. And I hope that some of those stories, and I tried to be thoughtful about all of the kinds of sectors and kinds of work that are represented, will feel familiar to some of the listeners who are chaplains, while also pushing them to really ask if what they're doing is similar to or shares a core with what these others who are calling themselves chaplains do. The lab is premised on the idea that we can learn more together than apart. And by bringing together chaplains from many different settings, we can engage in a broader conversation that will lead us to provide better care. So I'm hopeful that this book provides some of the intellectual rationale and background. I hope it helps in teaching, and I'll pop in the chat in a minute. I've put a lot of the primary documents up online. Michael and I developed a discussion guide. We really want this to be accessible and not sit on anybody's dusty bookshelf. So thank you again for being here, and especially to Barbara and McCall and John for being willing to offer some comments. I'm really grateful.
Thank you, Wendy. And usually, just to keep it simple, I go alphabetically. So Barbara, if you wouldn't mind starting us off with a panel response, that would be great.
Let me unmute. Good morning to everybody, and thank you for asking me to be a part of this, and thank you, Wendy, for doing the work, and I'm certainly grateful for all the work that the lab does. It's great to see this book in hand, having been around while you were still wrestling with it over the last couple of years, so that's always cause for celebration. And I want to basically briefly touch on just some issues that came to mind as I read through it, and again as I listened to you. And this will not be as well organized as your explanation of the book. And I guess the first question really does go to methodology, or to methods, because this is a very enticing way to think about chaplaincy, and one could imagine a constellation of local studies, and in cities like Boston or Philadelphia, or cities that are really quite different from both of those places, if someone were actually doing that work kind of place by place, then we'd have this really extraordinary kind of synthesis and kind of panoramic view. But barring that, I just wanted to think about a little bit about the relationship between history and practice, which is always, it has been in tension, and to ask, this is for our discussion later, or just in general, are there any, if you were doing a historical timeline of chaplaincy in Boston, if we want to be particular, or more generally, what would be the key moments in that history, if it could be excavated, and what could that tell us about sort of the contemporary shifts that are going on, not in particular, but in terms of the response and how the field, if you will, grows and evolves to meet some of those needs. Because it seems to me that would be a useful thing to know, is this notion of shifts over time. I think one of the things that, as you know, that has always concerned me about chaplaincy, for which I have a tremendous amount of respect and appreciation, but to really think about spiritual care in the various settings that you've outlined. I mean, how does one sustain spiritual care when the crisis of the moment has passed. And I know some people are actually working in institutional settings where there's continuity of service in terms of folks who are being, whose needs are being met. And I mean the military, prisons, but in healthcare, which seems to be a really driving force here, I really just have questions about the communal or community aspects of spiritual care, which are not necessarily the responsibility of a chaplain, but it just raises that question for me always, particularly as we're moving into a period of greater secularization. Where is the community and the kind of communal support that I also see as part of spiritual health or healthy spiritual, being in sort of a healthy spiritual community, if you will, where's the place of community in the world of chaplaincy? Not their responsibility, but that always kind of comes to mind when I think about the prevalence of crisis intervention and intervening on the edges, what you call the edges of American life. I very much appreciate your attention to diversity, both racially and also in terms of religion itself, which you do, across the board. It's certainly a place that doesn't look exactly like Boston would present, a more challenging, or just as interesting, but a more challenging kind of array of attempts there to, to address that. But I guess I really also want to talk a little bit about healthcare, which seems to be the driving area here. And is there any way in which spiritual care, as embodied through chaplaincy, can somehow become embodied in what we think of as wellness and preventative health care? Because this is the area where there seems to be the greatest amount of intervention and the greatest need around the kinds of issues that you laid out, but it does raise questions about the ways in which both the providers and also those who are being treated could benefit from a holistic model that actually is embedded in the healthcare system itself. And I'm thinking of mental health, but also is there a place for spiritual health in there, broadly defined, and that would be, some interest, to me as well. You use two different tropes. On the one hand, you have talked about a motley crew, reflecting the diversity of both training and background. And I don't think a motley crew is to be a part of one is a bad thing. But you also talk about lone rangers. And the idea of the individualistic chaplain out there kind of braving the day or whatever is coming, but it just raises questions about sustainability over time, both for the systems, but also for the individuals who are providing the care and, in my view, receiving it. And it's particularly a time where we're going through this deinstitutionalization of religion, and I would see chaplaincy as part of that, or as not causing or anything like that, but as certainly part of that. And I would just would kind of put those kinds of concerns on the table, maybe for us to talk about more, but mostly just to thank you for doing the work, and also for thinking about how this methodology might travel itself, and could it travel, to other sites, and what an interesting project that would be. And I hope that you might do that. And the final point I'll make is you talk about the question of religious ecologies. Can we give greater attention to, say, in a place like Boston, the community of chaplains that live and work there, and ways of organizing and meeting their needs that stretches across the institutional barriers that you've tried to overcome in the study by doing the broad reach. But in the end, is there an invisible, large, thriving community of chaplains in search of one another? And I would just leave it there, and thank you again for doing the work. Is that okay? Is that enough? Good, thank you. I look forward to hearing what other folks have to say.
Thank you very much. John, let's turn to you.
Oh my goodness. It is so good to see this book come out. And it's such a privilege and an honor to be part of this party for celebrating just years of work. And I think this will become a landmark book in the field of chaplaincy. And I think it should be in American religion as well, for reasons that we just heard. You know, the deinstitutionalization of American religion. This is part of that story. And just so appreciate how much you have done to lift up this profession and the lab. When I said I was going to be part of this, a friend who has been a chaplain and is clergy in the state of Missouri out here in the, flyover country said her Paging God book was pivotal to my work in CPE. And I hope that this book can do the same for chaplains across sectors. I want to lift up just a few notable qualities of the book. It is so rich. I feel like I need to read it 5 times. Just conceptually rich, empirically rich, and historically rich, which even though I'm a sociologist, I think I grew up so much with the American religious historians in my mental furnishings department that I'm just struck by the history of chaplaincy in Boston. And so one quality of this book is location, location, location. Sorry, but Boston is not the hub of the universe, but it might be the Garden of Eden of American chaplaincy in some ways. And I know you picked this because it was close to Brandeis University, and everybody needs to read the methodological appendix where you talk about methodology at midlife, because, as someone who's also trying to balance family and methodology, yeah, location matters, but you happen to have really good neighbors as far as the history of American chaplaincy. As you noted in the book, a lot of American chaplaincy started here in different forms. And we might think of CPE, but going back further, and there's an ambiguous legacy here, but it is still very important. The Ancient and Honorable Artillery Company of Massachusetts, you note in the book, was the oldest chartered military organization in North America and had chaplains in place in the 17th century. Now, of course, with the Garden of Eden comes original sin. And I think one thing to think about is chaplains accompanying the military in its wars and baptizing settler colonialism. I mean, that's part of the story too. There are happier parts of the story. I'd say mid-century of the 20th century, not the 17th century, Massachusetts was the birthplace of CPE, clinical pastoral education, which took shape at Massachusetts General, Richard Cabot and Russell Dix, people like that, but also at Worcester State Hospital, the work of the fascinating and I would say troubled visionary Anton Boysen. And in fact, when we were in Massachusetts, my kids really have the weirdest vacations. We stopped in Worcester because we had lived there. One of our kids was born there, but we stopped at the old remaining structures of the Worcester State Hospital. And it was remarkable to think about this man thinking about living human documents as my kids rolled down the grassy hill, because that was more fun than thinking about chaplaincy. Late in the 20th century, Boston University's Marsh Chapel was the home of Howard Thurman, a mystic, a prophet, a shaper of the civil rights movement, and let's not forget a chaplain, because I think somebody said, oh, I never knew that Howard Thurman was a chaplain. But as William Gibson put it at the premiere of the documentary that PBS did at the AAR, chaplains know Thurman. And so I think that's important to recognize. Location also matters because Boston illustrates the story that you tell and a lot of other people tell about kind of religious disestablishment and diversification, which is often fumbling, bumbling, sometimes intentional, sometimes by accident, but always fascinating and always not enough. There was a religious establishment, and yet there are pioneers in the Bay State. So one of the earliest sites of Hindu chaplaincy, which may go back to the 1950s, is MIT, which you open the book with in a later era with Robert Randolph and the horrible events after the Boston Marathon attacks. Were establishments too. There was a Protestant establishment at Mass General, which has given way, I think, in the chapter on diversity, to a multi-faith staff that could, maybe always be more multi-faith, ministering to patients and staff from every background. A mission to Scandinavian sailors, sponsored by an obscure Swedish Protestant denomination that I happened to grow up in. So I was like, oh, seafarer, yeah, I've heard of that. But they've retooled, and it's not about evangelism or proselytizing. It's about social services, and they're very intentional about that. It's also clear that there is and was a Catholic establishment that lingers, maybe even an Irish Catholic establishment, a Hibernian chaplaincy that lingers across the Commonwealth. And I just remember this when we lived in Worcester and I taught at Holy Cross, and 6 firefighters perished in the awful cold storage warehouse fire of 1999. Thousands of their brothers and sisters descended on the heart of the Commonwealth, as Worcester calls itself. They were mourned in a specifically ethno-religious way, with bagpipes playing Amazing Grace and Irish Catholic chaplains with names like Scanlon preaching the eulogies. The Catholic establishment really comes through in your book. The word Catholic appears 181 times. 181 times, Protestant just 101 times. Take that, Puritans. My Holy Cross students just couldn't believe when I said that Protestants once ran the show in Massachusetts. They thought that it was always, the Catholics were always in the majority. The lingering Catholicity is there, especially in police and fire contexts. And I think that is something that I think they struggle with. And I think that may be one of the biggest challenges, the whiteness of chaplaincy in Boston. And it's still largely Christian composition is one of the notable findings of the book. And people that still use particularistically religious language to their traditions. Conceptually, for me, the most valuable contribution is its discussion of space. For me, chapter 5, the value added of holding the space is the heart of the book. I'd love to know when you first fastened on this concept of holding space. Maybe it was in that interview. That word appears, the word space, 79 times. Sometimes it's an actual physical space, like the wonderfully named Our Lady of the Railways Chapel on page 30. Sometimes it's a metaphor, though, more often for the work that chaplains do, holding space, in between space, holding physical, psychological, spiritual, and emotional spaces for people. And I'm selfish about my love of this metaphor because we are coming across that very much in our research in religion and American higher education. And so in doing interviews just last week, I had your book in my head. And also, I'd already thought we need to be watching for spaces and places. And so hearing a humanist chaplain describe his work as creating a place for people to reflect, a Jewish student calling Hillel definitely my safe space, and another simply saying, this is my home. This is my home. Now, we know from Tom Tweed in Crossing and Dwelling that one definition of religion is to make homes and to cross boundaries. And I think you show these chaplains doing both. They are making homes for people in liminal places, as you say over and over again. I'm sure that the word liminal comes up more than just once or twice. And so this is so important for understanding the interstices and intersections of religion and spirituality in the 21st century. And then just to end, as you do, with this sort of uncertainty. You don't try to be Alvin Toffler or a futurist. You say, I don't know, it could go either way. And I'm really struck by both the fragility and also of this occupation that holds space, however tenuously, and that really it's sort of along the lines of the question about, well, is American religion going to look like Europe, or what is it going to look like, or is it going to look like a more diverse world with globalization? We really don't know. But thank you for this offering and for giving us things to think with.
Thank you very much, John. McCall, finish us out here, and then we have plenty of time for Q&A.
Okay, thanks so much for including me today. Wendy, it's a real treat to hear you talking about the book. I do love the book, and I'm very grateful to you. And it's great to hear you, Barbara and John. And I want to speak very much from my own embodied experience, which is first and foremost that I was born at Beth Israel Hospital in Boston and grew up in Brookline. And I felt like I encountered a Boston that was not accessible to me in my growing up. I love that phrase that you used, John, of lingering Catholicity, if I got that right. I was always aware of the Jewish experience being on the periphery of Boston, which is part of why I wound up in New York. But I also I speak both as a Jew and as a chaplain, that there's a marginality to being a Jew in an overwhelmingly Christian world here in the United States, and to being a chaplain in a world that is overwhelmingly talks about our religious organizations in doing so omits chaplains. So for you to center chaplains was already such a radical move. And I care so much about the passion that you have for fostering a field. I've been in this dialogue with you since you first invited me to come to a conference, which was housed in Brookline, Massachusetts. So you gave me an opportunity to come back to my parents' house, literally seeing their house as it is now, and discovering what I didn't see previously because nobody had shed the light that you're shedding on it, inviting us to think and develop chaplaincy into a field across all the different sectors. And in this book, very much grounded in one particular place. So it has the richness of the stories and the history and seeing the ways in which people have not come together. And I love that you said, you know, just scratch the surface a little and suddenly the chaplains emerge. What does it mean that they're still hovering under the surface? You show that it should not be so, that there's tremendous resources among chaplains. And so in engaging with you, I found that my own perspective has changed quite a bit. And here I want to speak specifically from my identity as an ACPE educator. So you asked the question, is the training working? Well, even before that question, you start to ask us to think differently about how we would even begin to approach that question by paying attention both to supply side and demand side. I worked at Jewish Theological Seminary for 17 years. And overwhelmingly, the world of seminaries focuses on the supply side and how we're going to do our business. And in your challenge here to look at the demand side, you're really asking us to reinvent theological education. And I would say reinventing it with understanding that when you look at the demand side, you have to look at chaplaincy education and know that people out in the world have a lot to teach us about what is needed in terms of skills, approach, where we're headed. So this idea of the world moving towards being spiritual but not religious, and the up and down sides that you talked about a little bit of where that may lead chaplains, because of course chaplains are supported by people who care about the spiritual life of people, even if we're not necessarily in primarily religious organizations. So there's a lot that we don't know, but what you have articulated so clearly is that when we start with the demand side, we have to let go of some of the things that we might be attached to in order to make space for what can be and needs to be. So we see this in your passion for including people of all different embodied experiences, people from diverse backgrounds, religiously, ethnically, racially, culturally, all different backgrounds, the attention that you pay to who is there, and of course, gender, who is there, who is not there. And one of the phrases that you use is that there are people who are saying, I'm a chaplain and I'm bringing my life experience. So here's where I want to speak specifically as an ACPE educator, where prior to engaging with you in this beautiful work that you've done, I had more of an ACPE prejudice. Now, I really value the work that I do as an ACPE educator, and I really believe in the way that the training equips people for chaplaincy. But your book highlights the ways in which there are lots of people doing this work who are not ACPE trained and come from different backgrounds and are drawing on what they know, sometimes from life experience and sometimes from other ways of knowing, that needs to be brought into the conversation with more of a level playing field to understand what is being attended to well and what is simply being missed. And when we do that, when we really open that up, and Wendy, I credit you so much with broadening my own perspective on this, which, as you know, has not always been easy for me. But when we broaden in this way, then we are moving towards making a space for everyone who is involved in this life-giving spiritual work. And we know that chaplains are drawn to the people who are most spiritually in need. You make it clear that this is in every dimension of life, every dimension of society. So let's be serious about being inclusive in all the ways that you've laid out. Let's learn how to tell this story. Let's lower the barriers that are preventing people from being part of the conversation. And I think that when we do that, there's the potential here for a life-giving, phenomenal next iteration of what chaplains can be. So Wendy, thank you for the work that you've done, for showing us the questions we need to be asking and how we need to broaden ourselves.
Well, thanks to all of you. There's so much richness in the comments. We could talk for the rest of the afternoon. Let me say a few quick things if that's okay. And then Michael, we can turn to the chat. Is that all right? So just a couple of points, and I'm not going to hit on everything because you asked me a lot of good questions. I wrote the methodological appendix because I think that we like to look at the shiny products and not always understand the process. And what I was trying to do in the methodological appendix is think about how I did my best to be a parent and a spouse and a researcher and an administrator, and what it means to continue to try to do field work at midlife. And so this project was in Boston because I'm in Boston. It's as simple as that. I wanted to do another project, but it would have required a lot of travel and it just wasn't feasible given my kids' ages at the time. So I would love for this approach to move to other cities. And some of what we've asked in the discussion questions are up on my website is if those of you that teach in other cities will have your students do projects like this, you know, small versions in your classes, and then send them to us and we can share them through the lab. Because I'm very clear that this is a Boston story and that the story in other places are different. And we need to and want to hear those stories so that we can think in a more holistic and national way about the work. Barbara, I also really appreciate your questions about healthcare. And I have long wanted and continue to work, if there are any foundations on the call, to figure out how to embed spiritual care in primary healthcare. And we know from studies in the UK that embedding chaplains in primary care clinics as kind of listeners is very effective, both for patients and families as well as for staff. And we've had quite a few clinics that would love us to embed a chaplain in their settings, but we've yet to find a funder who thinks this is a good risk to take. This points to the fact that at the moment, I would argue neither Chaplaincy nor the lab, sadly, have a clear business model because of what John spoke to about the work being tenuous and fragile and in the interstices. My title for this book was In Between Places, because I think that that is what chaplains do. The publisher preferred the current title because it's more descriptive, which I can totally understand. But to take John's points about the spatial metaphors, it is in these interstices, which makes it challenging in terms of business model risk. You know, we're trying to build the lab and this kind of future vision on philanthropy, which is only a short-term strategy. And it's something that Michael and I and our colleagues struggle with very regularly. So the healthcare piece is important. And your question about the community of chaplains, I think that's what we've tried really hard to build through the lab. And I've seen some of the questions in the chat. We're soon to be starting conversation circles for humanist, agnostic, atheist chaplains. So I hope that we can build some community there. Kirsten Boswell Ford continues to do an amazing job facilitating and bringing together chaplains of color in those groups. I think that you all know that we had a little bit of money left from a grant, and the program officer allowed us to host 2 retreats at low cost. We had 300 people sign up for 30 slots. So the retreats were wonderful, but there's enormous demand out there for that work and that support. And we see that. And, you know, someone in their spare time is looking at local family foundations. I mean, the more that we can partner to figure out how to build this broader community of chaplains across Boston, across settings, across different cities and regions, I think the stronger we're going to be. At one point in the book, I imagine a world, and it's an imagination, where, you know, someone is discharged from a hospital, say to a rehabilitation center. And while the medical teams do the handoff, the chaplain and spiritual care providers do the same handoff. And then when the person is discharged home to home health or perhaps to a nursing facility, there's the same kind of spiritual care handoff. And I can see in Boston the relationships that could make that possible. The infrastructure and the funding isn't there to do it. But what happens when we begin to think about the kind of continuities of care that chaplains can provide that are about not just physical health, but mental and spiritual and emotional health? And that to me is part of what motivates a lot of this work. John, I appreciate everything you say about holding the space. I'm not sure I can tell you when or how I came to that metaphor, but I do want to tell a quick story, which is that I was going through the list of all of the institutions of higher education in Boston and reaching out to make sure that I had talked with a chaplain at each of them. And there's one where I reached out to a friend who happened to work there. Do you have a chaplain? And he said, no, but you should talk to this person. And so I went to talk to this person. The story is told in the book, who happened to be a former religious professional who had left and was now working in student services and had part of what was his clerical cloth on a table in his office where he met with students and others. So he will say emphatically that he is not a chaplain. My colleague sent me to him as the chaplain. He has his stole over the table and is doing this kind of sensitive work in between places in daily life. And is a piece of what we don't see when we think too hard about the category. So I think that that's part of where this notion of holding the space comes from. And McCall, I appreciate your pointing to the supply and demand. And we are so much trying to figure out how to build from demand. So I saw a question in the chat. I was not able in this project to interview recipients of care. It's very hard to find recipients of care. But with the Gallup survey that we did, which was with a random sample of the American public, we were then, not me, but Grace Tian and Amy Lawton, my colleagues, were able to do interviews with 50 people who said that they had contact with chaplains. And we're in the process right now of writing that up so that we will have very clear kind of messages, what people remember, what they don't remember, from people who had that kind of contact. And I think that it's from that contact that we need to really, as McCall is calling us to, think radically and build differently. Because from what we can see so far in the data, what people remember about their contact with chaplains is maybe not what the chaplains think they're bringing or how they're trained. And I think the opportunity to build radically in ways that make space for all, including those in second careers or different kinds of things, is part of what we have to figure out how to do next. So this project we're doing right now about the supply of chaplaincy and the demand, we will be able probably by January to name the gap. And we know already what some of the gap is. We know that chaplains are not trained enough to work around moral injury, to work and respond quickly in traumatic situations. We know there's continued demand for diversity and or sort of engagement, experience, skill around diversity, and that a lot of training happens on the ground, not in the classroom. And so once we can identify the gap between the demand, what people remember, and the supply, how are people being trained, what we're thinking about now is, what do we do with that? What's the next step that brings people to the work? But again, most importantly, because of the need for care on the ground in what I see as our continued troubled world. There's a lot more I could say. Barbara, I love your historical question. If I was asked to make a historical timeline, I would call you and beg you to help me. And I should say that Barbara really has taught me a lot about doing this historical work. And we worked with Asia Anton on a project looking at the history of African-American chaplains with some preliminary materials coming out of Black newspapers. And that was really powerful to understand the role of the world wars in particular and how male the profession was for a long time. So there's a lot more work to do. And I really hope that this project spurs people to do the work and then to share it with us so that we can share it with the broader community. Michael.
Thank you. I do want to mention, for those who are in or near Boston, there's also going to be an in-person event, an in-person launch at Boston University School of Theology. They have their community center. It's down in the basement there. Very nice place. I don't have the address at hand, but it'll be on the website very soon. If you follow us on social media, those posts are going out this week. And so we do encourage you to attend. That's December 7th, I think 4:30 in the evening. So we encourage you to come there. Lots of questions. I wish we could answer them all, but we'll sort of get through as many as we can. And Joshua says that you touch on this idea of religious entrepreneurship. And so we've heard a lot about institutions and how they have developed, but this is sort of on the other end of a spectrum I'm making up right now. So say a little bit more about that.
Yeah, great question. So anyone in the United States can call themselves a chaplain. And I think that there are some people that I call religious entrepreneurs, people who are trying to do creative things in spiritual and religious spaces to offer new services or different kinds of leadership. And the term chaplain in some settings helps them because it's recognizable. So I tell a couple of stories in my book, and there are quite a few examples of people who are, I don't want to say using the term chaplain because that sounds like it's disingenuous, but the term chaplain helps them to translate or explain what they're doing, even as they came to that work in a very different way, where they're sort of trying to use the term and the category to kind of bust out of the traditional structures and organizations. And I think we can see that in many places. You know, if you Google chaplain, you'll come up with, I call them shingle hangers, you know, many people who are advertising their services as chaplains. Essentially, they're religious entrepreneurs. And there's a long history of religious entrepreneurism in the United States that is, again, another project we're trying to find funding to do to begin to map. Because as demographics shift, and there's certainly lots of attention to what's happening on the right amongst mostly white evangelicals, I think what's being called the none category, right? These people who are not affiliated, there's a lot of entrepreneurism happening in that category, and we don't yet have a way to map it. So this is another piece that we're looking to explore and is sort of related and not related to work about chaplaincy.
That flexibility of the term is, you know, it sort of cuts in so many different directions, being helpful, non-helpful, and so on. But a few folks have mentioned the sort of theological baggage that the word chaplain contains in chaplaincy and CPE. So what does, in your view, what does the future look like in terms of language? Are we going to be talking about chaplains in 20 years, or is that going to go away entirely?
Yeah, it's a great question. And I write about the different phrases that some people use. So spiritual care provider is a common phrase. In my work with McCall about Jewish chaplains, there's a lot of really thoughtful reflection because the term chaplain is really not immediately recognizable or comfortable to many Jews and other non-Christians because it is historically a Christian term. I think that for those who want to advocate for this work, they need to hire a fancy New York ad agency and try to figure out what the terms are that could replace it, but what people hear, right? What works for people on the ground? Because I think for the chaplains to sort of play around with the language is actually missing the point, which is that, you know, there's a set of skills and support that they're looking to offer. And how do we package that in such a way that it is accessible and of use to the people being served? So I think the simple answer to your question is I don't know. You know, I think this term comes a lot from the military, and the military changes slowly. So I suspect that the term will remain embedded there, although we're thinking about the endorsement process and some other things we could talk about that might shift it. I think that chaplains have probably strong futures in hospice and in healthcare organizations, which is where more than half of Americans connect with them. But whether the term changes or opens up, I think it will open up. I think it probably won't disappear. That would be my best guess.
Wendy, you've mentioned before that March 2019 survey the lab did. It took forever to define succinctly, here's what a chaplain is, because when people hear the word, they think something instantly. It's very clear and very bold and strong to them, but it differs from person to person. So, you know, coming up with a new term is not itself the end, you know, the end solution, because that's going to carry its own set of problems. Well, we're here at the top of the hour. Thank you all for joining us. Thank you, Wendy, for your time, for your book. I know that everyone here is excited to go out and find the book. So go buy it, read it, let us know what you thought. And as Wendy said, if you're doing things with it, you teach it, whatever, let us know. We want to share that and really magnify the impact of the book. So thank you to Wendy. Thank you to our panel. Thank you to the community for joining us today. We will see you later. Bye-bye.